Hey guys, Paramedic guy here. I thought I'd just do a quick video on what I carry on my person whenever I'm out working on the ambulance or doing any type of EMS work. So I got a couple of things laid out here. I'll go through them one by one, talk about how I use them, why I carry it, and why I carry that item over maybe another alternative. So I'll set the bag to the side just for a second here. And we'll start with the items that I mostly carry on my person. So, right here, this is just your everyday scanner you can pick up at Radio Shack. It's a Uniden Bearcat scanner. It's not a truncated scanner or anything like that. I can program it and listen to any frequency I need to scan our local fire and police departments to know what's going on in the area and kind of get a heads up with our interoperability and get a jump on those calls before I know I'm going to get them. So just a Uniden Bearcat scanner, programmable. Nothing too special here. These run about anywhere from $50 to $100. Okay. Well, believe it or not, we still use pagers. It's just an alphanumeric pager that we receive our call information on and dispatch information. Nothing special, and these are provided by the company. Not something I would pay for myself. Personally, I'd prefer it if it was sent directly to our cell phones as a text or an email. I think it'd be more efficient, but this is what we work with, and it gets the job done. All right. Now this here, this is called a Night Eyes S-Beaner. It's locking on both sides here. You can see the locking mechanisms. If I slide that down, I can't open it. If I slide it up, it opens. Does that on both sides. See? Now, this comes into use in a couple different ways. I've worn it on my belt loop to carry keys to the ambulance or our drug box, and I can lock it on both sides. So when I'm on a call or on a scene, I'm not going to lose those keys that I put on here. They're not going anywhere. Another great use for this is if we put it on any object on scene, on my person, on our shoulder epaulets, I can hang IV fluids and infuse them and freeze up my hands. So this has come into handy a lot. I've only had this guy a couple weeks, and I've already found a lot of uses for it. I'm probably going to pick up another couple of them just to have on hand and find other uses for them. So that's the Night Eyes S-Beaner. They're anywhere from $3 to $8. Pick them up at the local store. I think I got this one from Myers. All right, this here, this is a Right in the Rain all-weather vital stat notebook. It says the ultimate EMS notebook on it. So on the reverse side here, it's pretty helpful. It's got some rapid triage guidelines just to help with some things we don't use too much. And then on the front cover, got a pupil gauge and a quick reminder of our Glasgow coma scale in there. So kind of helpful stuff. But the really nice part is how it's laid out, just to get quick information on scene when we don't want to bring our computer or our clipboard into the patient's home or near the car, and we can just jot down some information. This works great with a regular pen, pencil, Sharpie, or a grease pencil. I've used them for years. This is probably about my 50th book. So these run about anywhere from $5 to $15 depending on where you pick them up. I believe this one came from Galls.com. Great little thing, fits in your pocket, no problem. All right. Now these little handy guys here, if we can get it to focus. Sorry for rocking the camera, guys. Using an iPhone. But these reference cards are indispensable. They are worth their weight in gold. They came from a company called Scrubs and Stuff, LLC. So it's escrubsandstuff.com. You can see it up in the right-hand corner there. This card in particular has all your pediatric standard vital signs, their ranges. You got your weight in pounds and kilograms, so great for conversions, your respiratory rate, your heart rate, and your systolic BP. This is fantastic because this is not often something as medics that we commit to memory. And this reference card is very durable, and it goes right on a badge reel. It's perfect. So let's go through. Alright guys, sorry about that. So we're going to look on the back of the card here. And on the back of that pediatric card, it will actually tell us what is age appropriate for the kid to assess for their mentation. So it goes all the way from birth to up to 8 years old. And a lot of times, you know, if we don't have kids ourselves, which a lot of us do, but some of us don't, I don't have a kid, it will help us understand how that child's supposed to be acting, if they're acting appropriately for their age group. So this is a helpful reminder for a lot of us to assess their mentation, because we can't sit there and say, hey, you know, little Timmy who's 1 year old or 2 years old, do you know what year it is? Do you know exactly where you're at? And can you tell us who the president is? That's just not fair nor realistic assessment based on their age. So this is just a helpful little reminder. So when we keep flipping through these cards here, we'll go into the next one. The next one is just a helpful chart of the hands and toes to remind us the numbers of each digit and phalange, you know, 1 through 5 on each hand, if we're talking about amputations or injuries. And then it gives us a helpful reminder too of dorsal, plantar, distal, and proximal. So nice little memory joggers. And then if we look on the back of that card, very similar thing for the whole body. And we're looking at reminders about distal and proximal again, lateral and medial, and dorsal, anterior, and that sort of thing. So it's a nice reminder when we're filling out our reports, if we need to be specific about where an injury occurred or where a pain complaint originated. So, okay. This next card helps us with our drip factors. So we can figure out drops per minute based on how many cc's per hour, if we turn the card this way, based on the drips that we're using. So if I needed 1 cc per hour and I was using a 10 drop set, it would be 0.2 drops per minute. So you can see how this would be really very helpful in calculating things like a dopamine drip or an epi drip while we're out there in the field and we don't want to touch our phones because we have maybe something nasty in our gloves. So these wipe off really easy too. On the back of that card is really nice, especially for a new medic or nurse. It's med math. So our standard equations that we use to solve for drip rates. Of course, I'm not going to go over in this video. I'll do a med math video later on. But this, for a new medic, it's great. This is something that they would love to have in their pocket on a daily basis, something that they can reference. Alright. The next card I have on here, it's hematology, coagulations, and blood gases. So some lab values, your standard lab values. We get a lot of interfacility transports, very sick ICU patients going to a tertiary care facility, and we don't have to, but I like to interpret the lab values and see what I can do for that patient during the transport. And this is a nice memory jogger for high and low ranges and to remember what's out of range. So that's what's on this side of the card. We flip it over. You've got your chemistries and your cardiac markers. So your troponins, your myoglobins, your CPKMB, all your ammonia, BUN, creatinine, chlorides, glucose, lactic acid, etc. Everything's on here that we need. As a quick reference, if the hospital doesn't have a reference on their printed lab sheets, which oftentimes they don't, but sometimes they do. Our next one here is just a simple temperature conversion, Celsius to Fahrenheit. And that's on both sides. And then my most useful one, believe it or not, out of all of them, is the pounds to kilograms. Oftentimes at 2 in the morning, when I'm trying to figure out a drug dosage, my brain fails me and I can't remember how to convert 52 pounds to 23.6 kilograms quickly enough. So I'll just pull this out and get an accurate drug dosage. Being accurate is much more important than sometimes being fast. So this is very helpful. And I think that's all of them. Yep, that's all of them. So again, these cards come from escrubsandstuff.com. You can see it up there in the corner. And I think they run about $2 a card. This is a great set. If I ever lose this, I'll purchase all of them again, no questions asked. And I just threw it on a badge reel. I tend to keep this in my, not my front pocket, but my trauma pocket on my right leg, and it just sits in there nice, and you don't even feel it in your pants. So it's really lightweight. But moving right along. Okay. Recently, I started working night shift. I never carried a flashlight before working days. I simply didn't need one. So I did some research. I did carry a Streamlight Stylus Pro for a bit. It was okay, but it wasn't bright enough. So I kept looking. I didn't want to spend a ton of money. And I came up with this guy. It's from Olight. This is an Olight Maverick M18. And you can see it's not that big. It's got two CR123s, which aren't the cheapest battery, of course, but it provides good power and allows this bulb, the Cree LED, to illuminate with 600 lumens. 600 lumens in this little torch. So, great pocket clip. It has not failed me yet. It's got this little extra part in there. I had the Streamlight pop out a couple times unseen, and I actually lost it. That's why I replaced it with this, because of the pocket clip. But this holds tight, and it holds nice and deep in your pocket. It has a tail cap switch, which is momentary. You can press it as momentary. You can press it down and lock it down. It has our mode selector up here. We can alternate between a 5 lumen low mode, a 100 lumen mid-range mode, and then your full 600 lumens, which will clearly light up a whole car or side of a house. It's extremely bright. The 5 lumen mode is great for just checking pupils. It's about the right amount of light you need, so it doubles as a pen light. I don't use it in that capacity, but I guess you could. Walking up to a house, that sort of thing is great. The clip on here fits perfectly on the brim of a hat, a baseball cap. It also clips really well into the pen pocket of our uniform shirt, so we can clip it this way and vertically shine it at the ceiling, illuminating the entire room. If we're in a house where we can't find a light source, in a vehicle, or our power goes out in the ambulance, we can illuminate by bouncing it off the ceiling, set it to the 500 or 600 lumen setting rather, and have working light with this little guy. And I don't know the runtime duration, but so far I've used it for about 2 hours and have had no problems with the two brand new CR123s. It has a strobe mode as well, and I'll do a demonstration on this flashlight in another review video. But the strobe mode's great for signaling other police, fire, and EMS providers where we're at if we need help. And that's how I've used it so far. So great little light, Maverick M18 by Olight. This came from Amazon.com, and I believe I paid around $50 for it. And if I ever lost this, I wouldn't be too upset because it wasn't too expensive, but I would definitely replace it with the same light again and again. So great little light, not too heavy. Alright, so there's only a couple things remaining that I carry on my actual person. The next 4 items are very simple, but I would be lost without them as a medic. So this is your everyday simple pen light with a pupil gauge on it. Nothing special here. You click it to turn it on. They're cheap. They're disposable. When the batteries die, we toss them. I keep it down in my scissors pocket on my right leg, check everybody's pupils, and I don't blind them, as you can see. It's only about maybe 5 lumens. These are very cheap. You can get 5 of them for about $10. So, and they last a while. Last a good while. My pen of choice that I carry on duty is the Pilot G2. They last. They fit great in my pocket. They don't pop out. I used to carry a Zebra. I lost a couple. They're expensive pens. These aren't. I like click pens. I don't like having to take a cap off while we're on a scene. The only thing that I found that this does not do well, it does not write on gloves well at all, but it works great in my field notebook. So, and also works good to tap on the screen of the Tough Book and annotate things or draw pictures as a stylus. So it's got the nice grip on it. I like the G2, always have, and I'll probably continue to carry it until I find something that I like better. So that's it for my pen. The good old Sharpie. It's just a fine point Sharpie. I use this primarily to flag IV lines with silk tape, and then I'll write the drug name on them so we can have IV safety. I also use it to write on IV bags the time that it was hung and mark how much we infused on it. That's pretty much all I use it for. Outside of that, of course, there's thousands of uses for a Sharpie, and as a medic, it's a great thing to carry. I just carry that in my pant leg pocket too. So, standard trauma shears. Nothing special. They're just stainless steel. And yes, they do cut a penny. If you do cut a penny, it will ruin them. These are the cheapy ones. They get the job done. They cut belts, pants, shoelaces, all that great stuff. And really, honestly, I don't use them that much. I use the tear hook on my Gerber Hinder a lot more to tear clothes off. You can grab somebody by the collar and rip their shirt right in half with that tear hook. These you got to sit there and cut. I carry them just to have them. But again, I maybe use them once or twice a week, so that's about it. That does it for the stuff I carry on my person. We're going to do another video that goes into this guy here. Get in the frame there. Goes into this guy here. This is my bag that I carry on the ambulance with me, and it doubles as my EDC. It's a great little bag, not expensive. It's not Maxpedition, and you'd be surprised how much I paid for it. So that's coming up in the next video. I hope you guys enjoyed this. If you have any comments, questions, feel free to ask and let me know. If you want, I can post some links on where I got the items, and I look forward to making more videos. So this is my first one, and many more to come, and we'll start doing some education videos as well. So, alright guys, take care and stay safe.